For folks who don't really know what nodules are, you can think of these as like freckles and moles on your skin, right? That everyone has them, or most people do. Most of them are benign. And so these are the same thing. They're little spots on your lungs, and most of them are benign. But sometimes, based on the size, based on the way that it looks, I want to call you back sooner than 12 months. Usually that would be the case, that I would recommend a follow up in 3 or 6 months. Very, very rarely, I will recommend a biopsy or a PET scan. And that's because I think it's suspicious enough. But the false positive rate, in terms of calling you back a little bit sooner, I think, in my opinion, and Heidi, I would love your opinion on this. I think that's pretty different than sticking a needle into somebody's lung, or biopsying something, right? It's just to make sure that something doesn't change or grow. And if it does, okay, then you go on to the next step. And probably waiting that short amount of time, it gives us some more information about what this nodule is. And so, in terms of the false positive rate, the false biopsy rate is very low. If I'm sending someone for a biopsy, I'm really, really sure that this is cancer. Nothing in medicine's 100%, but it's pretty darn close when I'm sending somebody for a biopsy. So that's kind of in general. And then I guess the last one, of course, and as somebody who's been on the receiving end of this, I got my first mammogram this year, and it was abnormal. They had to call me back for diagnostics, and you're kind of waiting for the results. And you go and you're like, I'm young, I'm going to be fine. And so then you get these tests and you're waiting, and there is some anxiety that comes with that. Just something you kind of can't prevent. So that's probably the last thing, right? Is there's always going to be some anxiety around waiting for your test results and being worried. But at the end of the day, this test is really meant to just check and make sure everything's okay. Most of these tests are going to be normal or negative. But when we do find something, it's important to kind of face it head on.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.